every possible thing that can be a distraction or can be a blessing, either ways.
But I don't see that penetration in the market. Like, people are still not aware about it. We are currently in a phase where there's a myopia pandemic happening, a silent one. Powers of 2, 3, 4, abhi wo 5, 6, 7, 8 ho rahe. More and more people are getting specs. More and more people are getting glasses because itni near activity human beings ने पहले कभी की नहीं है. So there are some ergonomics. कि the screen should be positioned slightly below your eye level so that everything is just relaxed. So that there's a smooth transition when you're looking away and looking at the screen. That is how you should use the screen.
I think what a knowledge bank Dr. Mickey is. So one thing what we realize is that 20-20-20 rule, this was a big takeaway. I think some of you all would already know. I think this is, maybe for you it is just a basic set, but for me and all the listeners and viewers, this is going to be a very important piece of advice for them to know how to deal with their cell phones, their gadgets and people who are around them. Great.
Glad it helps you. I'm glad.
Okay, guys, so today we are on our podcast show, the show with Transformation and Dr. Kunal Buch. The best part is that we just don't share any knowledge. We share the knowledge that will be worth and value for you. And that's why today on our show, we have none other than the most celebrated, young, dynamic, smart, dashing actor turned surgeon, Dr. Mickey. Please put your hands together to call Dr. Mickey over here.
Thank you.
Hi.
Thank you for so many adjectives that you use. Thank you. How are you?
I'm doing good, doctor. And first of all, I doubt if anybody would want to believe that doctors can be so handsome, because padte to, people really go crazy, they go boring, or maybe their interest of life is different. But I've always seen you with a lot of spark from day one until today. Every time you are with that speed and the spark. How do you manage and how do you feel being a doctor and a surgeon? The best part is eye surgeon.
No, again, thank you so much for all your compliments. This is wow. Being a doctor is, both the experiences that I've had in life, I'm so grateful, number one, for that. I got to be a part of the entertainment industry, and as a child I worked and I got to meet such great people and had a very different take on life, got to learn a lot of things. Right now, I think it's the most rewarding phase of my life wherein I get to do, again, extremely grateful for this, to do something which brings in so much value to a person's life. Meaning, we see the world 90% through our eyes. The remaining 10% accounts for your skin, for your hearing, for your taste as well. So, again, I'll divide this into two parts. When a young person comes and he or she is struggling with her confidence or his confidence and things around spectacles, ki chashma pen ke, not able to do the interview well, not able to ace, and when I get to do their lasers and when they feel that wow, and they move beyond that, it just gets you the best night's sleep. And even people who are older, for them, chashme nahi pehenna, because it is something which is a thing which they feel ki it's such a big thing. Mm-hmm. And people of my parents' age and beyond, when I get to remove their glasses via cataract surgeries or others, that blessings and those smiles just makes my day. So yeah, it's extremely rewarding. And yeah,
lovely. From being an actor, working with Hrithik Roshan, met him many times, multiple times in his entire career. Before being a doctor, surgeon, and now even after being a surgeon, I've seen a lot of his reels with 90K followers and giving so much of real-time content on the platform where people are really viewing something that might not be useful, but at the same time, we have people like Dr. Mickey who are doing really wonders. So great. First of all, great to know that you would fetch out this time to come and talk to us and share your piece of knowledge. And now, with your permission, I would want to first start with a little personal question. Okay. That being an actor and now being a surgeon, do you miss being an actor, or you use your acting skills or entertainment skills in your medical and science world that you have? How is it?
I think we go a long way back. That's why we're here. That's why I'm here. And I think we've had this discussion ki not to look back. You always learn from whatever experiences life has to give you. So yes, I do the latter. I have learned and try to keep learning from the past and try to apply it here and then grow. So yeah.
Lovely. Superb. So chalo, let's get started with some roller coaster of questions. Are you ready?
Done. Come on.
Yahoo. Great. So today, in this world where we are shooting a podcast, a lot of other people, influencers, are shooting a podcast. We have every possible thing that can be a distraction or can be a blessing, either ways. But जैसा हमने सुना है कि कोई भी चीज़ ज़्यादा करो तो वो हानिकारक हो सकती है. It might be a damaging. So first and a simple question to put up to you is, what is the minimum screen time that one should have when they are either they are working or a student, or if you feel it should be different for all the age groups?
So interesting question. I would say कि we are in the age where the car has been invented, the seatbelt yet has to come, and then the airbag. So right now there are no guidelines that are very specific. So minimum screen time for an adult, it's all a very gray area. However, fortunately, the American Academy of Pediatrics and all over the world, there are guidelines for children that are in place.
Great.
But I don't see that penetration in the market. Like, people are still not aware about it. For example, I just break it down to you. So up to the age of 18 months to 2 years, there is zero screen time which is recommended for children. From 18 months, 2 years to up to 5 years, it's only 1 hour a day. That too, they have defined how do you consume screen. It has to be educative, informative, and along with the parent. So this is how the screen has to be consumed by a child. Beyond 5, again, it's about 2 hours a day, but then it becomes all grey. And for adults, कुछ definition फिलहाल consensus नहीं है. I mean, we'll get to other parts of it, but yeah, when you say the word minimum screen time, unfortunately, there's no particular answer for this.
But in case if I have to ask you, not just kids or toddlers, but especially the age group. So I'll show you one instance that really hit me hard in a way where I was sad that parents or the newly what do you call, न्यूबॉर्न के पेरेंट्स जो होते हैं वो शायद रेडी नहीं होते हैं फॉर द बेबी और न्यू लाइफ इन दे आर रनिंग ongoing schedules of whatever they are doing. And so for them to easy side lane is to give a cell phone. Now in my case, like at our house, we've kept this as a culture that a child is not supposed to touch or even pick up a cell phone until parents allow. So me, my dad, my mom, my wife, my sister, we don't allow my daughter to, pick up a call. She comes and says, okay, this is the call. So she's 8 right now. No video games played till date. She's 8.5.
Oh, okay.
No reels, no nothing. Only if we are watching something which is something that we can show it to her, then maybe 1 or 2 reels which are relevant to a joke or a movie, song or whatever.
Okay.
Now this would be one of the cases in 100 or one of the cases in 1,000 or one of the cases in lakhs. I don't know.
Correct.
But when I see a 1-year-old kid swiping, sitting in a restaurant, parents are giggling, laughing, and the kid is swiping reels. Now that child doesn't know what is he actually doing, he or she. But a parent would know what the kid is doing. How does this affect the eye at an early stage of swiping the reels? And eventually that affects the way they think or they grow. That is one part of it. But eyes को कितना ये बुरी तरह से affect कर सकता है, आपको क्या लगता है?
So yes, the impact is massive. Like I told you about the facts, there are guidelines up to the age of 5 which are not being followed very clearly. You go to a restaurant, you follow this. It's unfortunate that time is an issue and multiple factors. The way it works is the eyes when they are growing. Okay, we'll talk about the eyes first. When you're doing too much of near activity, and especially it's not for education purposes, you start inducing myopia. We are currently in a phase where there's a myopia pandemic happening, a silent one, wherein where we would see powers of 2, 3, 4, abhi wo 5, 6, 7, 8 ho rahe. More and more people are getting specs, more and more people are getting glasses because itni near activity human beings ne pehle kabhi की नहीं है. देखो पढ़ाई करना, that is all essential, but then that stops at a particular time. 6 hours, 8 hours के बाद that is done. People would go out, play. I do understand the nuances here, कि playgrounds have become less and everybody is doing that, so it's a social thing that's happening. But your eyeballs, in order to not go into that myopia zone and in order to not have very high myopias, myopia is your eyeball becoming longer than it's supposed to be. That is what basically a minus glass is. Now, beyond particular levels, it's manageable, but if it's too much, if there is too much myopia in the future, there is a risk of weaker vision, retinal detachments, many more things happen in the future. So in terms of the eye, itna near activity jab hum karenge, so this is what is one of the most common things that is happening that we're seeing currently.
Okay.
The mental benefits and the mental disadvantages of ADHD and everything, that is something which is, imagine, I mean, the attention span has become 3 seconds of a hook of a reel. Everybody, including ourselves, are doing this.
Yes.
Imagine फिर बच्चों को, you give them a toy, they'll not be able to play. I mean, that's what's happening because they just want so many stimuli and the mind is still developing till the age of 5. You cannot just bombard that and then confuse the child, and then the child suffers eventually in the long run.
So this information is especially for the people who are planning kids or who already have kids who are 0 to 5 or 0 to 7, I would say, where avoid or rather completely zero down the screen time for your child, especially what did you say, the small screen,
Near vision, yeah.
near vision. Television agar aap, there is a culture of putting on the television and feeding a child and all. I don't know where all this comes from and why it's been continued, but if you ask me as a coach, or if you ask Dr. Mickey as an eye surgeon, we are not in the favor, or we would never recommend anybody to have such kind of a culture, and especially for the kids who are 0 to 7. So if you're a parent of a kid 0 to 7, make sure you don't give them a cell phone, tablet, gadget and near screen, because you are not giving them any education or making great things for them. You're spoiling their future being their parents themselves. So please don't fall in that trap.
Just one more point I'd like to add. The child who's growing, how does he learn? It's by observing. It's by what's happening around. So it becomes your moral responsibility as well, at least till a particular age, say till the age of 2, 3, at least आप TV उनके सामने मत देखिए, आप phones मत चलाइए. That will, I think, make a lot of difference. I understand it's very difficult, but it can be done, is what I think.
Wow, lovely point. This reminds me one of my sessions that I take in coaching, and that's where we advise. Obviously, we give a little a bigger bandwidth of having digital detox through the day or in between the gaps of the day. That once you wake up for 90 minutes, avoid touching a cell phone, or once you are about to be to the bed, 60 minutes prior to being at the bed, avoid your cell phone. And I think somewhere what Dr. Mickey said, it relates to what I am coaching, not being a surgeon, and what you added a lot of value with a scientific touch to it, that avoid doing things in front of your child, because they will learn what they see. And when I say see, means they're actually observing you. And to bypass you doing your duties, don't give them a side lane with a short distance screening. That's gonna spoil their future, and you will be the reason for that. So please don't do it. So great. So now the next question comes is, as we all go to these different great outlets of spectacles, I think one is the Lenskart that is most prominent these days because of Shark Tank. One of the sharks is the owner. So what they do and what they sell is they always try to upgrade the glasses by saying that you should wear glasses if you have a screen time, or if you have more screen time, the blue ray cover. So how much does that really safeguard your eyes, A? And is it really some science, or it's just a marketing gig? What do you think?
So giving an absolute statement here is a little questionable, but there is no direct data which points that blue light can actually damage your eyes. Okay, it creates a strain on your eyes, yes, but damaging your eyes, there is no evidence directly. So what happens is, what you need to understand कि light has a spectrum, सारे colors उसमें होते हैं. Okay, sunlight के अंदर भी there's blue light. What really happens is, when you say about blue light, it can just help you with some strain part of it, but what happens is towards the night, blue light is for a signal to your brain कि आप जागो. Okay, sun में वो होता है. अगर आप ये blue light जब रात को use कर रहे हो, तो आपका brain सोच रहा है कि अब मुझे जागना है, पर आप सोने वाले हो, फिर आप सो नहीं पाओगे, and that vicious cycle continues. So maybe little bit there, some advantages, but not really to damage or safeguard your eyes. The mental and the ADHD and the sleep cycle, and those are the effects that mainly happen because of blue light. Because the amount of blue light that actually comes out through screen is not too much, it's very minuscule, but it's about what you consume, number one, and consuming it at that time. So hygiene is very important. Stopping using your screens per se is the answer. कि आप सोने के पहले यू हैव टू स्टॉप यूजिंग स्क्रीन्स. जब आप काम कर रहे हो कंप्यूटर्स पे, ergonomics कुछ होता है. Ergonomics is see, screen you have to use. You have to accept that they are a part of our life. We can't look at it as a very negative and a bad thing. Like even my prescriptions I type are on a screen. Like I dictate, it's typing, and I'm printing. So there are some ergonomics. Ki A, the screen should be positioned slightly below your eye level so that everything is just relaxed. Then the brightness of the screen should not be very much, or should not be too less also. It should match your surroundings so that there's a smooth transition when you're looking away and looking at the screen. That is how you should use the screen. Contrast should be high. And then there is a 20-20-20 rule. That means that every 20 minutes of using any screen, kuch bhi kaam karo, just for 20 seconds, look 20 feet away. What happens is your muscles start relaxing because of distance pe dekh rahe ho. Near me, your muscles have to contract and they are working constantly. Dur dekh liya to muscles relax. So it just replenishes, get back to your work. So it's more about an overall way of approaching things, and rather than just those blue lights will magically do something for you. Blue light filter bhi hota hai every screen mein, so that is.
I think what a knowledge bank Dr. Mickey is. So one thing what we realize is that 20-20-20 rule, this was a big takeaway. I think some of you all would already know, but you're not practicing. And today on this podcast, when I hear it again, like I had heard about it, but I never gave it a little important maybe. But अब आपने कहा है तो मैं और seriously लूँगा इसको. And 20 में, after every 20 minutes, if you're on a constant work professional as an editor or as an office desk job, after 20 minutes, for 20 seconds, watch or observe something 20 feet away that relaxes your muscles is what doctor advised.
Exactly.
And the best part, what I was always confused, because when my editor or somebody who's working on my comp for a moment, or they always used to reduce the brightness. And I used to shout at him कि इतना कम क्यों है, he has to look like this, ऐसे छोटी आंखें करके. तो मैंने brightness बढ़ा दिया. So now today I realize that it should not be more, it should not be too less, it should match your surrounding. So either you can keep it on auto, which I think is a feature in the cell phones usually. But so use these simple and basic doable hacks to safeguard your eyes. And one of the best answers that he gave, or one of the best knowledge part he shared, is that के blue eyes, blue ray से आपकी eyes damage होती है, उसका कोई proof नहीं है, पर हाँ स्ट्रेन ज़रूर होता है, और उसे कैसे कंट्रोल करें. एंड वो ब्लू रे क्या है, उसका लॉजिक जो डॉक्टर ने समझा है, इट्स अमेजिंग, क्योंकि ब्लू मीन्स योर माइंड सेज यू हैव टू बी अवेक, इज व्हाट ही सेड.
Exactly. Those.
एंड ब्लू लाइट इज ऑल्सो इन द रे, सन रे ऑल्सो, दैट ब्लू. वाह, मुझे आज तक नहीं पता था. हम रोज़ सुबह उठ के सूर्य नमस्कार करते हैं या सूर्यदेव को प्रणाम करते हैं, बट उन किरणों में ब्लू कलर का ग्लेयर होता है जो हमें ये बताता है कि हमें जगे हुए रहना, ये नहीं पता था. So thank you, doctor. I think this is maybe for you it is just a basic set, but for me and all the listeners and viewers, this is going to be a very important piece of advice for them to know how to deal with their cell phones, their gadgets, and people who are around them. No, great.
I'm glad it helps you. I'm glad.
Lovely. So my connecting question to this is, because you are from the entertainment field also, because you have been doing films.
Yeah.
And as an actor or as a model or as a glamorous person, what if somebody wants to use lenses without having any particular reason or a number? स्टाइल के लिए पहनना होता है, तो कितना सेफ है, कितनी देर के लिए पहन सकते हैं, क्या कोई डैमेजेस होते हैं, नहीं होते हैं? प्लीज कैन यू पुट सम लाइट ऑन दैट?
Sure. Wearing contact lenses occasionally, it's absolutely okay. However, how do you wear the contact lenses, and the hygiene part of it is extremely important. See, every lens comes with a number of hours that can be worn. The concept is, जो टिश्यू पे आप लेंस लगा रहे हो, द कॉर्निया, दैट इज एन एवास्कुलर स्ट्रक्चर, मतलब उसको खुद का ब्लड सप्लाई नहीं है. इट डिराइव्स इज ब्लड सप्लाई फ्रॉम द एयर. So now when you're keeping even the best lens you get, it's going to cut off some percentage of the air and the oxygen from that. Now when that happens, you have to be wise कि आप इसको पहन के 16, 18, 20 hours काम नहीं कर रहे हो, इसको पहन के आप सो नहीं रहे हो. You have to be very mindful about this कि beyond say 10, 12, 14 hours maximum, let's keep it at 12 only is the overall guidelines depending on the lens you have to remove it. Another thing here is कि if you're wearing it consistently, what many people don't do is they don't clean the solution. If it's a monthly thing और आपने आज पहना और आप 4 दिन के बाद पहन रहे हो, ये नहीं हुआ कि आपने 4 दिन के बाद खोल के फिर साफ किया. यू सपोज टू क्लीन इट एवरी डे. अगेन हैंड हाइजीन समथिंग विच इज लॉजिकल कि आप जब करो हैंड्स तो, बट द सोल्यूशन ऑल्सो हैज टू बी रिप्लेस्ड एवरी 24 आवर्स. सो इफ यू डू इट राइट, इट्स अ ग्रेट थिंग. बट इफ यू अंडरस्टैंड कि आपका यूजेज कंसिस्टेंट है, कि सपोज इफ योर जॉब डिमांड्स दैट एवरी डे ये पहनना ही है, then a safer option, because every day you're risking an infection, and lenses के साथ जो infection होते, if at all that happens, those are very bad, very difficult, and also sight threatening at times. A safer option for this, for people who are using it consistently, would be to get a laser done and take care of it once and for all, because that itself is a very, very, very safe procedure, and it's a one-time thing. Here you're taking a risk on an everyday basis if it's consistently and daily used. If not, then doing a laser is the best way out. So well, yes.
Because you've been mentioning about laser, I think twice in this previous conversation. Can you please highlight a little more on how easy and up to what cost the LASIK surgery can be?
Okay.
And what is the minimum age that somebody can go under the laser, or what is the maximum age that doesn't give a risk of damage? So a bandwidth, age group, and the cost factor of it.
Okay, so age group, let's understand the concept कि हम 21 की बात करते हैं उसको. Why? Because up to the age of 18, 21, your eyeball is still growing. It has to stabilize once. So that happens internationally. 18 guidelines. In India, we say 21. So after 21, you are a candidate to get a laser done. That's number one. Number two, you ask me, is the cost. Now, cost depends on center to center and the technology used. See, laser machines have been since 20-25 years. So depending on what technology is available, costing varies. But to put a number, somewhere around 25 to 30,000 rupees per eye, say like it goes to up to 70-75,000 rupees per eye. Again, very variable depending on what city you're in, depending on what technology is. Because this is one procedure wherein the technology is say 80% of the job and 20% is your doctor's job. Being the doctor, I'm telling you this because the latest technology does have so many benefits and has made it so much more safer and so much more precise that it's really worth the investment. Now, understanding what a laser is and how fast it is say a 10-minute procedure in and out. Okay.
Wow, are you serious?
Yeah, and the recovery, depending on again what, there are many types of lasers, but the recovery is usually in like 24 hours to 48 hours if you do a LASIK. So it's a weekend procedure. Many professionals who karate wo Friday, Saturday, they get the thing done, and Monday they're almost able to work on their screens, and Tuesday, Wednesday they are doing entire days of screen. So it's that quick turnaround in terms of recovery and your downtime.
Wow. So in case if anybody wants to ever do a LASIK surgery or want to understand how it works and want to get comfortable with getting the laser thing done on you or for your family or anybody, I think you can definitely go and visit Dr. Mickey because he's being so honest about how it happens and how much time, and obviously the cost part is your personal choice, but even if you're just going and consulting him, I think you will get a absolute genuine feedback, and second thing, if not that he won't become or be your surgeon, he'll at least become your friend forever because he'll keep giving you the advices whether you ask or not. So that's Dr. Mickey for me and many others, and I'm sure if you want to visit him, I think that would be for you also. So great yaar. I mean, I didn't know that laser surgery is that easy because जिनको है specs वो डरते हैं कि चश्मा ही पहन लो यार, सर्जरी क्यों करवानी है या.
Exactly, I'll address this as well. When you talk about fear and statistics, आप Google करोगे कि coffee is good for your migraine or bad, you'll get both the answers. So it's a rabbit hole which is there online about the safety factor of LASIK. Just to give you an understanding, I myself had a power of 8.5 minus, and I got a LASIK done myself, a laser done. Okay. So if you talk about safety, I am actually an eye doctor who got a LASIK done. So you understand the safety part of it. मतलब मैंने कराया मतलब मैंने सब समझ के deep dive करके आप समझ रहे हो मतलब all the understanding possible, like this is literally what I do for my living. I did that. So that is the safety part of it. And yes, you're right. Most people come and they are just scared कि आँख की surgery है. And my own mother, for example, for the longest time she was like कि अरे बेटे की आँख की surgery है, and so many myths back then about a lot of things. So when you understand everything about laser and understand what we're actually doing, it's just that we're operating only on the surface of the eye. जहाँ आप contact lens लगाते हो बस वहाँ पर. And the size of this procedure is about 100 microns. जितना एक बाल होता है. So it's that much. It's only this much. And your eyeball is still so big, right? And you're working only on so much. You're not going inside the eye as well.
My God. Okay.
So it's actually it's so many myths around it. But most people who come in and ask about LASIK, they are just scared. And once they understand actually ho kya raha hai, then the decision becomes actually very natural.
Yeah, this is so cool. I mean, I'm really glad that my eyes are absolutely fine. And I keep testing my eyes by looking at the bus number that is traveling right or the left or the front of my car to figure out कि मेरी आँखें कैसी है. But it's a very cool thing. अगर आपको spectacles हैं, आपको लगता है that you can feel more confident or better without those spectacles, then style के लिए आप भले बाद में पहना, but you can definitely go for the LASIK surgery. And I think the coolest way is the way he explains it and makes me feel comfortable. I'm sure even you will feel comfortable about this. Superb, doctor. I think you're just too good, bro. I mean,
so just one more thing. When you said you get your eyes checked by looking at the bus numbers, I would say there's actually very grey guidelines around this कि कब आँख check करानी, because eyes का problem is कि the symptoms come in very late when you have a problem. So as a routine, if you're young, just get, like, if you're young, old, whatever age group, if you have say diabetes, blood pressure, all the more, just get an eye checkup done. Like even if it's once a year or once in 2 years, just get it done and let's see if there's something which can be picked up early. So
very good point. So here I want to ask you, doctor, one thing. Which age group has got maximum eye issues? Is it 0 to 20 or 20 to 40 or 40 to 60, or it can be random? And the second question that I was about to ask, you answered that how frequently we should have an eye checkup, 6 months or a year? And again, for what age group, what bandwidth?
So again, when you're above 60, that is the number. So every age group has different eye problems that we see. It's not the same for each age group. So when you're above 60, once a year should be good. Okay. If you have diabetes, then whatever age group you are, once a year is essential. Okay. And if you're young, once in say 3 to 5 years, one routine checkup should help you with a lot of things. And especially there's one more thing I'll just highlight, and because there are not very specific guidelines that are followed. There are guidelines, but they're not really followed, and it's very difficult to tell you, and then you get scared about it and actually think about it कि किसी ने बताया नहीं. Just give you one example is the commonest age group that is currently working in the big population of India is around 40 plus. There is something known as glaucoma, which is eye pressure. So when I say the word eye pressure, लोगों को लगता है ये होता क्या है, ब्लड प्रेशर सुना था, आई प्रेशर नहीं पता. सो दिस इज समथिंग विच हमारी बुक्स में लिखा है कि दिस इज द साइलेंट थीफ ऑफ साइट. मतलब ये आपकी विजन चुपचाप ले जाता है इफ इट्स हाई. यानी कहाँ से ले जाता है, साइड से ले जाता है, धीरे 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 करके ओवर स्पैन ऑफ 10 years सडनली यू कम टू नो कि मुझे कम दिख रहा है. हाउ डू यू कैच इट? इट्स जस्ट एन आई एग्जामिनेशन. And if it's high, it's like taking your blood pressure medicines. It's like putting drops, and it's controlled. Wow. So those are things जिसकी जब सिम्टम ही नहीं है तो आपको लगेगा मेरा सब ठीक चल रहा है, जैसे आपने बताया बस के नंबर दिख रहे हो, बट आपका प्रेशर हाई है कि नहीं, जस्ट फॉर एग्जांपल वी डोंट नो. Again, not scaring you.
Yeah,
but if you come, get a checkup done, and even if it's high, we manage it, right? So, but for that you have to come. For that you need to understand and just be mindful about the fact that your eyes, they're very hardworking. They really compensate for a lot of things, but they don't give you symptoms until things have gone a little beyond.
And I think what I've felt, or what I know people when I talk to them as a coach, that they are only concerned about their lifestyle, business growth, money growth, relationship management, but or maybe slimming down, slimming and trimming down, and body weight and the bulk or whatever. Nobody is actually concerned about their eyes. Nobody is concerned about their tooth. They feel brushing once a day is good, but some doctors say दिन में 2 बार करना चाहिए. मैं तो करता ही हूँ. कोई कहता है 3 बार करो, कोई कहता है ज़्यादा हार्ड ब्रश मत करो. Same is with the eyes. I mean, not everybody is. I don't think out of 100, maybe even 20 people will be concerned who would want to go for an eye checkup with their own will, or unless and until they will see this podcast. So anybody who is in any age group, as Doctor just mentioned, and we'll obviously put it in our caption, or we can make a short clip of it, that how often should you go for an eye checkup with a different age group. And while you were mentioning for the age group 60 and above, as my parents, they are 70 and they have gone through that what do you call it? Cataract.
Yeah.
So do they still have to go and check up every year if they're done with the cataract?
Yes, I mean, again, there are no mandate guidelines, but there are again certain things such as age-related macular degeneration. That is something which is literally there in the name. कि आपका macula मतलब retina can undergo degeneration.
Okay.
If it's found, again, limited ways of treating it, but there are tablets also. There are injections that can be given to you to help you at least prevent or delay the onset, delay the progression, and give you the best possible vision at an early stage. But again, the problem is it has to be seen. These are things that are found only on examination.
Correct.
They are symptoms per se come in unfortunately later.
Correct. And one specific note for the diabetic patient.
Yeah, for diabetes, what happens is, again, if you want me to go in detail here, diabetes also is something wherein your blood vessels become more fragile. They start breaking. Now, सबसे पतली blood vessels 2 जगह पे, kidneys and eyes. You must have heard diabetic patients dialysis भी जाते हैं.
Correct.
वो आप पकड़ते हो creatinine test जो blood test में हो ही जाता है.
Correct.
लेकिन diabetes patients very commonly also go into something known as diabetic retinopathy, which is the same thing happening in the eyes. Your blood vessels rupturing and खून आ रहा है आँख के अंदर. Now, here also the problem is कि ये साइड में होता है, but हम बीच से देखते हैं. तो पेशेंट को सिम्टम नहीं पता. One fine day जब बीच की नस फटी, and when there is fluid around and when there is loss of vision, that is the time we pick it up, and then it's challenging for the doctor also to treat. So again, if you have diabetes, very important thing is that you should talk to your physician and get your eyes checked, and should be done at frequent intervals as decided according to the stage of diabetic retinopathy, if there or not, how many years of diabetes you have, and what your ophthalmologist suggests. So again, a silent thing which is happening very commonly. And diabetes, India is the diabetic capital of the world, and not too many patients are even aware that being a diabetic, this can happen to their eyes.
Wow. So while talking to you, I got just one random thought and an idea. I would wish to organize eye checkup for all the diabetic patients or all the diabetics. And if you are okay, we can definitely give them your address or however, and we can have a nice eye checkup I don't know however you want to organize, because this is something where people don't know that they are getting damaged.
Exactly, yeah.
एक होता है जो दिख रहा है, पर एक है जो दिख ही नहीं रहा है. तो while talking to you, I feel we should do this, and I think all you people, until we decide to do something, you should do something for yourself, because if you have had a diabetes in your life at any spot, any age, it's your time to go and check your eyes and keep a regular check, because this beautiful world is really beautiful, and you have all the right to keep seeing it till the last day, till the last breath. Great. So yeah, so heading towards the end of this beautiful conversation that we had, now because you have been in your clinic and this life as a surgeon, as a doctor, what is the maximum cases that comes to you for a particular reason? Like, for example, in our industry, we have a particular kind of inquiries that fall in more towards us. Similarly, क्या complaints लेके लोग आते हैं? Maximum complaints या maximum problems कहाँ पे है?
Okay. So again, it's again divided as per as age, different ages. But the most common thing that is happening now is headache. Now, this is something which is like what happens is कि when the patient comes, they've tried these glasses from the optical stores, because usually people को जब नहीं दिखता कम तो they go to the optician. There they like आपका test कर लेंगे. They give you those numbers and you still continue with that.
Yeah.
What happens is because of this extreme use of near vision, you know, your intermittent near vision पहले हमने इंसान ने कभी इतना यूज ही नहीं किया. What is happening is कि जो muscles आपकी eyes की, they are going into spasm and fatigue. So there is a very specific type of strain glasses that come in, which only an eye doctor can pick up and diagnose. There is a very methodical procedure to get that done. You have to put some drops, dilate करना होता है, then your true numbers are revealed, and then we call you on a next visit and then give you those glasses. And वो glasses आपका headache जाता है. So ऐसा नहीं.
Sorry to cut you, but I mean this is such an important thing. आज तक maximum लोग शायद कई सालों पहले, even me or my family members, we used to go to an eyeglass store or a fancy store or a ordinary store, and we used to figure out कि भाई number है कि नहीं बताओ. And जब हम when I go to buy shades, even I see people sitting and doing their eye checkup, and we trust that guy so blindly. Rather than doing that, I think we should, as doctor is suggesting, that we should go to a proper, renowned, technical, scientific doctor, person, clinic, whatever you believe in, and please get it checked through an expert, not just go to some store and get your eyes checked, because that's the most valuable asset of your being, I guess, right?
Yeah, these are hidden numbers. There's so many people who the store says कि zero number है, but actually हम diagnose करके निकालते हैं plus 0.25 plus 0.5, and that takes care of the headaches and the symptoms. So yes, hidden numbers.
And what I like is as a doctor or as being in a profession, I think it's easy for anybody to just get the job done in a quick one day or one visit. But as he said that there are some procedures that they follow, and दो visit लगते हैं and then आपको, so I think there are efforts going to make your eye be safe, and I think that's really superb. And headache, I mean, yeah, अगर आपको headache हो रहा है तो आपको ज़रूर जाना चाहिए. लोग headache के लिए क्रोसिन खा लेते हैं, डोलो खा लेते हैं, and they feel it's been dodged for that moment.
Yeah.
How easy or how good it is to just survive on dolo or crocin when you have headache? What do you think?
I say, I mean, I understand that you can't just keep treating the symptom. You have to find the cause. Like headache is a big term. There could be many reasons, but what's happening now is it's lifestyle, right? Like, I mean, this generation now who was say 20s pehle, now they're coming to their 30s, going to the 40s, and all of them are on their screens. Itna near vision aa raha hai. So a big and common cause is becoming just your screens and getting the right correction, because you are making your eyes work so much. When it's getting tired, it requires a little push of the right numbers, if at all, and then headaches is taken care of. You like, how much can you do that? I mean, it's not just the headache part of it. Your headache has a bigger approach and bigger problem in your life. आप परेशान हो गए, you will fight with your spouse, you will be frustrated, you will not be able to work. So many things happening because you're not understanding the cause. So if headache is because of the eye, it's so manageable. But all it needs is the 2 visits to the doctor. Yeah.
तो बस जैसे बच्चन जी कहते हैं 2 बूंद जिंदगी की, पोलियो से बचा लेगा, वैसे 2 विजिट डॉक्टर मिकी के यहाँ आपकी आंखों को बचा लेगा. आई थिंक दैट्स द बेस्ट वे आई वुड वांट टू कंक्लूड दिस. सो डॉक्टर मिकी, इफ यू कैन जस्ट पुट द इन्फॉर्मेशन टू ऑल आवर लिसनर्स एंड व्यूअर्स, how and when can they meet you, where will you be available, which all locations are you, I mean anything that you would want to add, so most of the people who are going to seriously take this podcast seriously. And if they want to see you, please, if you can just address.
So I'm working Monday to Saturday from morning 9:30 10 o'clock से लेके रात के 10 o'clock तक. So I'm there all the days. I am practicing in Bandra West, in Santa Cruz East, and in Kurla. To find my details, you can look me up on Instagram. That's number one, Dr.Mickey. And you can just put up my name and you'll find the addresses. My contact number or website is again dr-mickey.com. And you'll find me on Google. And yes, one message or one phone call should get you an appointment in 3 of these locations.
लवली, ही मेड इट सो सिंपल. सो आप कहीं पे भी रह रहे हो, सेंट्रल में, वेस्टर्न में, सबर्ब्स में या टाउन में, इट्स ऑल सेंट्रली लोकेटेड. सो फॉर योर आइज, इफ यू थिंक दीज 2 विजिट्स, विच आई डोंट थिंक सो विल टेक मोर देन एन आवर ईच, आई थिंक पूरे ज़िंदगी में से 2 घंटे आप निकाल सकते हो अपने आइज़ का ध्यान रखने के लिए, अपनी आँखों का ध्यान रखने के लिए. And I'm really glad, I'm really blessed by God, and I'm really happy to have an association with Dr. Mickey for more than, 5-6 years now. And the best part is he's kept in touch even without a reason, when I didn't know that I'll ever do a podcast with him. And listening to all what he's guided, all of us, including me, you, and all the people who will listen and view this, I will make all my podcasts really small, crisp, and more informative, so we don't damage your eyes. Okay, thank you so much, doctor.
Thank you for having me. Thank you so much. Lovely,
Thank you
lovely.
so much.
Thank you.
Super.
Thank you.